Hi, this is Dr. Mark Taylor. I'm at the Gateway Aesthetic Institute and Laser Center in Salt Lake City. Today I'd like to talk to you about what I've learned in the last 47 years of treating acne scars. And this presentation is specific to certain scar types. In my experience over the past 47 years, I've treated thousands of patients. I'm a board-certified dermatologist, fellowship director for cosmetic dermatology and laser surgery with the American Society for Dermatologic Surgery. I've tested and used virtually every technology that's ever been invented for the treatment of acne scars, and I founded the largest cosmetic laser center in the world, the Gateway Aesthetic Institute and Laser Center. So what causes acne scars? Well, it's caused mostly by inflammation associated with acne that causes tissue damage. Also, picking at the scars and other factors can make the scars worse, such as makeup, medications, heredity, activity, environment, irritation, stress, hormones, and many other causes. So in this presentation, I'm going to present some evidence-based information. That's information that's been published in major medical journals. And also I'm going to present information that I've gained personally from treating acne scar patients over the past 47 years. There are a few general principles about acne scar treatment. The scar type determines the treatment of choice. Combination therapy usually provides the most improvement. Patients with dark skin require special precautions to protect their pigment. Let's talk about the different scar types. So atrophic scars are caused by a loss of tissue as a result of the inflammation of acne. And this includes ice pick scars. These are deep, narrow, pitted scars that look like holes in the skin. Rolling scars, these are usually wide, shallow, with sloping edges. This is the most common type of acne scar. And then box scars, as the name would suggest, they're like a box with vertical sides and a deep depression in the middle. Also, hypertrophic and keloid scars. These are types of scars that are raised up. They can either be red, itching. They can be, mature hypertrophic scars that are just lumpy, but not red or inflamed, and without symptoms at that point. Also, scars that have different kinds of pigment. Loss of pigment would be called hypopigmented scars, and scars that heal with darker pigment are hyperpigmented scars. These are much more common in skin of color. So let's talk about my methods of treating rolling acne scars. This was published in a peer-reviewed journal, Dermatologic Surgery, in 2017. You can see the reference here if you'd like to look it up. And in this method of treating acne scars, which I've used now over the past 15 years to treat thousands of patients, we use subcision to release the scar bands that are pulling the skin down, giving it a dimpled appearance. And the one thing about this device is we can do a very thorough subcision of the entire scarred area, not just a few individual scars. This releases the scar bands that causes the depressed or rolling scars. This is highly effective in rolling acne scars, especially on the cheeks and temples and on the forehead. In this video, we are marking the rolling acne scars that are present and more visible when we use harsh lighting to mark those scars. In this video, we're using a focused erbium laser to smooth the edges of the scars to give a more even contour in relation to the normal surrounding skin. This is done prior to subcision. In this video, we are using focused ablation, and this helps us flatten the high points of the scars, especially papular elevated scars or a whole field of box scars, pitted scars, and rolling scars to just blend the areas of elevation to bring them down lower to the common level of the skin that is going to be left when we're completed. After we've done the focus laser and smoothed the edges of the scars, we will then instill something called tumescent anesthesia. This is dilute anesthesia that we put into the skin. Here we're doing that in the safe zone, which is just below the dermis, and we're infiltrating this to make the skin completely numb, to expand the safe zone that we're going to use for subcision, and also this decreases any risk of bleeding during the procedure. When we do subcision with the Taylor Liberator, we do that after the tumescent anesthesia, and we usually let that sit for a little while to make sure the skin is completely numb. The tumescent and the epinephrine in there helps us to relieve any risk of bleeding from the procedure. And then we very thoroughly go under the entire scarred area to release those scar bands and allow that skin to elevate. What we're doing with subcision is basically separating the top of the scar from the bottom of the scar, and it's like cutting the strings on button upholstery. Then the buttons will pop up, and the it will be more level than before. One of the lasers that we use often after subcision to help blend the entire area is the fractional CO2 laser. In this video, we're using the fractional repair laser to go over the entire scarred area to blend surface irregularities in the skin. We also use other types of lasers for this part of the procedure depending on the type of scars we're treating. This is a patient in whom we did all of these steps, and this is her 2 months following the treatment. Fractional lasers include non-ablative fractional lasers like the 1550, 1540, 1320, and 1064 nanometer lasers, and also the erbium lasers and the CO2 lasers are called ablative lasers. That means they actually vaporize and remove tissue. So the limitations in using these alone is that they do show some improvement, but without doing the subcision, you do not get as much improvement by just using fractional lasers alone. By combining both the subcision, smoothing the edges, and using CO2, either fully ablative or fractional, we can achieve an average of 72% improvement, which is what we reported in the study published in Dermatologic Surgery in 2017 on 114 patients that we had treated. So the combination treatment, including subcision and these other steps, gives us much more improvement than just using laser alone. Here is an example of a fully ablative CO2 laser that we are using to smooth the surface of the skin after doing subcision and other steps that we have mentioned. Sometimes we'll also use a light chemical peel to blend the other areas of the skin together. So the Taylor Liberator provides the most complete and extensive subcision when combined with CO2 fractional laser resurfacing or fully ablative laser resurfacing. If we do use the trichloroacetic acid peel, we simply use that to blend all of the normal areas of skin together so that overall the patient has a much more cosmetically pleasing appearance. One of the other fractional ablative lasers that we'll use sometimes in darker skin types is the fractional erbium laser. In this laser, we're also using an ablative fractional laser and making multiple passes across the skin to blend the irregularities that occur in acne scars to make it more even in the entire scarred area. The last laser that we will often use for this blending procedure is a fractional 1064 pico nanosecond laser called the Starwalker laser. This is actually ablative as well, but it is very cold laser, so we don't get a lot of heat. And this works especially well in patients with dark skin who are at higher risk of post-inflammatory hyperpigmentation. It also heals a lot faster than using CO2 and erbium. So it's another good choice for the final blending step that we use. This is a patient who is older with lots of acne scars, and also at his age he has some wrinkles. This is him before on top, and at the bottom after doing subcision and fully ablative CO2 laser resurfacing with more than 80% improvement in his acne scars, and also improving the texture of the skin and removing some of these wrinkles. This is a younger girl with lots of rolling acne scars before and 1 month after her treatment with subcision and fractional CO2 laser. This is a young man with horrible pitted scars and box scars on his forehead. We excised most of these scars and then also did subcision prior to the excision, and then fractional repair laser after the subcision, and then the excision was the final step. This shows his improvement. Here at the top is before. This is 1 week after. Here we have him a few months later, and here he is 2 years after this procedure with exceptionally good improvement in the appearance of his acne scars. This is a lady in her 40s with really deep rolling acne scars. This is before and after doing subcision and fully ablative CO2 laser resurfacing. This is a young man whom we had also rolling acne scars on the cheeks, again doing subcision, trichloric acid peel to blend the normal skin together, and then fractional CO2 laser only in the areas of scarring to again blend and give a more even appearance. Here's a young woman also with rolling acne scars on the cheeks, same type of treatment, subcision with the Taylor Liberator and fractional CO2 with the fractional repair laser and a light chemical peel to blend the rest of the skin together. This is a unique patient that we treated. He had a lot of atrophy in these areas of his rolling acne scars, so we did subcision. We did some fat transfer underneath his skin on his cheeks to bring some volume back to his hollow cheeks, and then used the Starwalker fractional 1064 laser to do the surface treatment. This is him about 1 month after his treatment. In this patient, we also did the subcision, and then we did fully ablative CO2 and erbium combination laser treatment with a laser called the Derma K laser that gave us a very nice improvement in her photoaging and sun damage, in addition to the scars that she has on her cheeks, and also notice the improvement in the wrinkles on her upper lips and on her forehead. This is a young man also with a darker skin type, and he had rolling scars on his cheeks and somewhat on his temples. So we did subcision with the Taylor Liberator, and then we used the fractional erbium laser to do the surface treatment of the scars in those areas of his temples and cheeks where he had his rolling acne scars. These are all single treatments. Some patients continue to be bothered by their acne scars their entire life. Here's an elderly lady who came to me not because she was getting wrinkles, but because she had wrinkles and acne scars. Acne scars leave bad memories in people's minds of a ruined teenage life when maybe they looked horrible, when they wanted to look beautiful and attend dances and be socially active and do things that where they felt confident being in a social situation. Recently, I've treated patients who have been so embarrassed with their acne scars that they have not left their home in over 13 years and have been socially paralyzed because of the lack of confidence and the embarrassment of acne scars on their face and sometimes other areas. This is one of our best patients. We treated him with subcision and the fractional CO2 laser, and he had outstanding improvement that lasted. We saw him 6 years later, and he still looked equally as good as this. This is an older man, again, with both wrinkles and acne scars and the memory of somewhat of a ruined youth because of bad acne. We treated him with fully ablative CO2 laser and subcision with the Taylor Liberator extensive subcision procedure. Sometimes there are some slightly depressed rolling scars or even box scars that are left over after this procedure. In this video, we're using a method of treating with filler using a product like Restylane Lift to raise up the depressed leftover acne scars to the level of the normal surrounding skin. This is an excellent procedure, and if we repeat this once every 8 to 12 months, we can often stimulate the production of new collagen and completely fix these leftover depressed scars. So what about the popular procedure microneedling? Microneedling is everywhere. Almost everybody has a microneedling device, especially all of the med spas that are out there. Many of them not doctors, not highly trained in skin or in acne scars. And so millions of microneedling procedures are performed every year on acne scars across the country. This does stimulate some collagen after a few treatments. It can be used on all skin types. The limitations are it's not very effective. Almost all of the patients that I treat for severe acne scars have had some microneedling procedures with almost no improvement. To get any improvement at all, it does require multiple sessions. And so most of the patients are very discouraged after doing these procedures because of minimal improvement. This is, again, a very commonly performed procedure, and I hardly ever use this when I'm treating acne scars just because it doesn't work very well and it kind of wastes people's money and resources trying to fix these scars with this modality. What about autologous platelet-rich plasma, that's PRP? This is often combined with microneedling or subcision. It enhances healing and collagen. The limitations are that PRP, even though it's been shown to improve healing, it's not effective in removing surface irregularities caused by acne scarring, including pitted ice pick scars, box scars, and significant rolling scars. PRP is also not an effective filler in atrophic acne scars, so it's probably helpful in the healing process, but standalone it doesn't do much, and even combined with another type of procedure that doesn't do much, it's fairly disappointing when you're dealing with significant acne scars. How about pitted ice pick scars? These are difficult. These are one of the more difficult types of scars to treat. So these are deep, they're narrow, less than 2 millimeter holes that look like large pores lined by epithelium. So they have a skin lining inside of that point, of that pit. More common in patients with oily skin. And often they're associated with lots of extra oil glands, sebaceous hyperplasia, prominent visible oil glands, and kind of a greasy appearance to the skin. In this video, I'm going to show you my favorite method for treating pitted acne scars. Here I'm using a high energy erbium laser with a very finely focused tip to ablate these pitted acne scars. After this treatment, then the skin heals back together. It may take a month or two to get the final result, but it is much more efficient than some of the traditional ways to fix acne scars, such as using TCA cross. That's a chemical ablation of pitted scars, which is applied like with a toothpick, or something like phenol that also chemically destroys the epithelium inside of a pitted acne scar. But it's actually kind of a prolonged process that takes multiple sessions, and in my hands is not as efficient, not as effective, and requires multiple sessions. Here we're using the laser again, the Photona SP Dynamis laser with a finer tip to treat large pores and smaller pitted acne scars. This helps us remove the epithelium inside of the scars, and then the scar can immediately start to heal instead of waiting for the chemical sloughing of the epithelium inside of the pitted scar. This shows a patient before and 14 months after treating his pitted acne scars and large pores with focused ablation using the erbium laser. This is another patient before and 6 months after doing treatment. Again, for acne, pitted acne scars and also some rolling scars. So I mentioned earlier the use of TCA cross, which is trichloroacetic acid applied focally with a toothpick or other fine pointed applicator. The mechanism of this induces collagen remodeling by chemically destroying the epithelium inside of the pit. Usually requires multiple sessions, on average maybe 3 to 5 sessions. It can be used in all skin types. However, occasionally it will cause the scars to be wider. It will destroy a larger area of the skin that doesn't heal back together and leaves sometimes a larger diameter, deeper pit that is quite upsetting to patients with this type of scarring. How about punch excision or punch elevation? Some scars are very, very deep. So let's say if we have a pitted tight acne scar that's larger than 2 millimeters in diameter, sometimes it's really just best to punch that scar out and then put a stitch in. Here is another method of treating acne scars that's often used, called microneedling with radiofrequency. What does that mean? So regular microneedling, needles are on a motorized device, poke in and out of the skin very quickly, creating some damage and some collagen regeneration. With RF microneedling, it pokes needles down into the skin, and then those needles release radio frequency energy, so it's kind of like burning the skin at the tip of each of those needles. And then as that skin heals, sometimes there's some improvement in the scarring. But if you think about it, how does poking a needle in and out level a surface that is uneven? It really doesn't make much sense. And in my experience, even with multiple treatments with RF microneedling, the results are fairly disappointing, especially in patients with severe rolling scars, box scars, and pitted scars. It's not one of my favorite treatments. And even with aggressive high energy treatments, sometimes you can leave scars and actually make the condition worse. So this is also an extremely popular laser treatment in med spas around the world. For one reason, it doesn't require much training. Many of the med spas do not have doctors supervising the treatments, and people are usually told they need 3 or 4 or 5 treatments. And many of these patients, I see them later very disappointed in the amount of improvement they've had, and they've spent a lot of money, suffered a lot of pain and recovery without getting the benefit of looking much better. Here's an example of RF microneedling. The needles go in and out and then release energy as they're down deeper in the skin. So I mentioned earlier the possibility of punch excision or punch elevation. This can be combined with some of the other procedures. If I do this at the same time I do subcision or laser resurfacing or focus laser or pitted scars, this is the final procedure that I will do at the end of my one and done type procedure for acne scars. And if you look at this video, we simply take a device that's like a little cookie cutter and pull out the scars, and then we can put a stitch in. Up above here, we've actually done excision and of larger box scars and sutured those areas back together. How about fractional laser resurfacing by itself? Erbium and CO2 are fractional ablative lasers, and again, you can make some improvement, but much better improvement is seen if it's combined with subcision of those depressed areas of scars that are almost always present in patients with extensive acne scarring. So I mentioned the microneedling with PRP. This is also a common procedure done in med spas around the world. Again, it's easy, doesn't require much training. This is often done by estheticians or nurses or even doctors, but very little improvement is usually seen even with multiple treatments using microneedling and PRP. Some healing, some collagen stimulation, but in my hands, this method of treating acne scars is often quite disappointing. How about hypertrophic or keloid scars? Hypertrophic scars are simply scars that heal with lumps. They stick above the skin, they're elevated. Hypertrophic scars are different than keloids because the bumps are kind of stable and just sit there and give an uneven texture and appearance to the skin. Whereas keloids are actively growing scars. They're usually red, they're often tender, they may itch, they frequently occur in areas like the mid-sternum, on the shoulders, and other areas that are highly susceptible to keloid type scarring. When we treat these scars, my first line of therapy is to inject these scars. Usually I do a combination of corticosteroids and triamcinolone acetonide. combined with 5-FU. Usually our injections are every 2 to 4 weeks, and we may combine this with botulinum toxin, or we may use it in combination with non-ablative lasers, such as the 1540, 1565, 1320, or 1064 nanometer lasers. And I do like the combination of injections and laser done on the same day. I feel like we can get very nice results in many of these patients. This is an example of a patient with keloids, acne scars in the mid-sternal area. This is the highest risk area on the body for hypertrophic scars from acne. You can see that over a period of treatments, and it does usually require multiple treatments spaced about 3 weeks apart, we were able to get significant improvement in these painful, itching, miserable acne scars in the center of the chest. One other thing that we often recommend is the use of silicone gel sheets or topical silicone, usually in combination with the intralesional injection of steroid and 5-FU. We will have patients wear silicone tape or strips continuously on their scars in between treatments. This has good scientific support in the literature, and is often used on many other types of excisions to reduce or prevent keloid scarring. Cryotherapy has been used in the past for keloid scars. In this therapy, liquid nitrogen is used to freeze the keloid or hypertrophic scar. This destroys some of the tissue, and then that can sometimes heal with a reduced volume and shrink and look better. This is somewhat of a brutal treatment. It's not my favorite treatment. We did this 30 or 40 years ago in some scars, and I've pretty much abandoned this as one of my favorite treatments for keloid acne scars or hypertrophic scars. I think the lasers and the non-ablative and ablative lasers combined with injections are much more effective. So another treatment for hypertrophic or keloid scars is laser therapy. There's good evidence in the literature that pulse dye laser can help, especially newer proliferative keloid scars that are red and itching and fairly new. Also, lasers like the ND-YAG laser, that's a 1064 nanometer laser that can be used in a non-ablative way. That has been shown to be very helpful in treating hypertrophic and keloid scars. And sometimes we use both of these lasers together on the same day. One must be careful when having treatment with the ND-YAG laser, because inappropriate settings or treatments with inexperienced personnel can leave bad scars if the proper settings and techniques are not used. Usually it requires multiple treatments, and works best, again, if you combine it with the intralesional injections of steroids and 5-FU. So surgical excision and other therapies of keloid scars. I'm not a big fan of simply cutting out keloid scars and suturing the wound back together. Keloid scars have a high risk of recurrence because the person who got the keloid in the first place has a much higher risk of making another keloid in the exact same spot where you cut out the original keloid. So doing this, I frequently will combine it with injections. Some patients can also be treated with excision followed by radiotherapy or X-ray therapy, and this can be highly effective in the treatment of keloid acne scars. One of the other types of acne scars that we see that bothers people is scars that are hyperpigmented. They heal, and following inflammation, the skin takes on a darker color. This is especially true in skin of color. Patients with black or brown skin will often heal with hyperpigmented scars. This is something that can be treated often, especially protecting the skin with sunblock products, sun protective clothing during the active acne breakouts, and also afterward using bleaching products such as hydroquinone, azelaic acid, niacinamide, and I use also a product that I've worked on for many years that's extremely helpful in treating pigmented skin. This is Cosmeon Skin Brightening Gelate, available at cosmeon.us. This is my invention and can help to bleach acne scar pigmentation. Also, I like a product made by Skin Medica called Even and Correct. This is a good product, and I don't see any adverse reactions to these products, especially in skin of color, something that occasionally may happen when using hydroquinone in patients with darker skin types. The picosecond and nanosecond lasers can also be very helpful in breaking up the pigment in hyperpigmented acne scars. Again, I can't recommend enough the use of good sun protection, especially while healing, either after your acne scar treatments or after a breakout of acne where inflammation has left the skin red. Because if you go in the sun with red skin after having acne or surgery, you may get post-inflammatory hyperpigmentation and the skin may heal darker brown. So how about chemical peels? Chemical peels are not really effective in treating acne scars. And the reason is that when you do a chemical peel, you're basically peeling a superficial layer of skin off the top of the scars and the normal surrounding skin. So there's really not much of a leveling effect, actually improving the appearance and the smoothness of the skin surface. Overall, chemical peels can make the skin look better. They may help with some hyperpigmentation. Chemical peels may actually help with treating active acne. I like to use two ingredients in a product that I invented called Cosmeon Mama Lotion. That's mandelic and malic acid, and these are helpful in exfoliating comedones and plug pores and actually helping the skin look a little bit better, helping wrinkles. And mandelic acid is also somewhat antibacterial. So it's a mild treatment that can help both acne and may help somewhat in the appearance of the acne scars, but certainly not enough to create a level surface to the skin, which is what everybody wants. I mentioned laser therapy for treating darker hyperpigmented acne scars. Usually we use low fluence, either with the Nd:YAG laser in darker skin types. We can also sometimes use low fluence with a 755 laser like the PicoSure. I do like that laser for treating hyperpigmentation of both acne scars and things like melasma and PIH. And these lasers are safer for patients with darker skin types. One thing I've mentioned, and it's very important, is to use sun protection with broad spectrum sunblock daily with large brimmed hat and UV face shield, especially after acne breakouts or after having an acne scar treatment where the skin is going to be red for a few weeks or sometimes even a few months. Protecting really well from the sun will help to reduce the risk of post-inflammatory hyperpigmentation and allow people to heal with a more beautiful skin. How about hypopigmented acne scars? These are very difficult, and there's not an easy solution to white acne scars. Repigmentation is difficult. If there's just a few white acne scars, sometimes surgical excision of the white scar and suturing is the most effective treatment. In this patient who had many white depressed acne scars on her temple, we excised a total of 14 scars. This shows just the excision of scars on the right side of the temple and face. We also did additional scars on the other side. And the photo on the right shows her improvement 2 months later. For this girl, it was actually curative for her. She was able to leave and go to college and not feel embarrassed about her scars. So this is often a really good solution for a limited number of white depressed acne scars. So fractional lasers alone do not stimulate repigmentation of white scars very well. They may help somewhat. They may actually help if combined with the application of a product like 5FU and or Latisse, which is a product made by Allergan for increasing the growth of eyelashes and eyebrows. Sometimes using fractional laser along with the post-operative application of 5FU or Latisse can stimulate some repigmentation in some of these white acne scars. There is anecdotal reports of microneedling and PRP helping white acne scars. Again, I think that that's hit and miss. It may work, but again, like so many other microneedling things, it's very popular in poorly trained med spas, and again, maybe a waste of money. If you get lucky, it may work and help you get more normal pigmentation back in your white acne scars. So in conclusion, it's my opinion that effective treatment of acne scars requires scar type specific approaches tailored to skin phototype. Combining modalities, especially thorough subcision, microneedling, chemical peels, and targeted laser provides more improvement. The laser treatments combined with subcision are my very best treatment results in the past 47 years that I've been treating extensive acne scarring in thousands of patients. Skin color benefits from low-risk pigment-safe strategies with strict sun protection and other measures to protect the pigment. My treatment recommendations based on scar type include for rolling scars, I like extensive subcision with a Taylor Liberator and fractional or fully ablative lasers. We average around 72% improvement in a single combined session. Box scars, if they're deep, I think they're best excised. If they're more superficial, we can blend the edges of the box scars with focused laser resurfacing and then do subcision to help elevate the base for a better, smoother appearance to the skin. Again, with pitted ice pick acne scars, I like focused laser ablation. That gives immediate ablation of the pitted scar and the healing is faster and my improvement is greater in a single treatment than with multiple treatments using something like TCA cross or focused application of a caustic chemical product like phenol. I rarely recommend microneedling or RF microneedling because they show minimal improvement in my hands even with multiple sessions. Repeated injections of filler in leftover rolling scars can be very beneficial, and with repeated injections spaced maybe 8 to 12 months apart, we can often see somewhat permanent improvement in leftover depressed rolling acne scars. Keloid scars, again, I like lasers combined with injections. And in hypertrophic scars, ablative and non-ablative lasers, again, combined with intralesional injections of steroid and 5-FU, and continued use of topical silicone gel or tape. Hyperpigmented scars, topical bleaching, and picosecond lasers or nanosecond lasers can help a lot. And white scars, excision if possible. And if not, it may be worth trying stippling the white scars with 5-FU or Latisse. So I appreciate the time you've spent with me on this presentation of the treatment of difficult acne scars. This is a passion. I've been doing it for 47 years. I've treated thousands of patients. I've tried every modality of acne scar treatment you can imagine. I work with 3 other board-certified ASDS fellowship-trained dermatologists, Dr. Megan McLean and Dr. Kimberly Hirth. We're all board-certified dermatologists and ASDS fellowship-trained. We work at the Gateway Aesthetic Institute Laser Center in Salt Lake City, Utah. If you want additional information, you can use this email, info@gatewaylasercenter.com. We also offer virtual consultations and treatment plans with an estimated cost for patients all over the world. A few hours ago, I was speaking with a young patient from Peru who is very disturbed with his acne scars on his cheek. He's planning to come in December for his treatment, and I think we will have an extremely good result for his type of rolling acne scars, limited to the middle of his cheeks. Again, thank you so much for watching. I hope that if you have bad acne scars that are depressing and ruining your life, or at least the memory of these scars is very upsetting, I would love to help you regain your self-confidence and get as much improvement as possible in the acne scars that you're suffering from. Thank you for watching. Goodbye.